Veneers are a restoration basically made out of porcelain. Over the last 3 or 4 years, we have a restoration that's much stronger than what we had just 5 years ago. A veneer is a porcelain, a part of a crown. It's usually on the lip side, obviously. It doesn't cover the entire tooth. It's very thin, up to 3/10 of a millimeter thick, which is probably less than the width of your fingernail. It's bonded onto the enamel. It's very strong. Many times we'll do veneers without having to remove any tooth structure whatsoever, and if that is possible with any patient, that's what we want to do. We want to reduce the minimum amount of tooth structure necessary to get the aesthetic result. Obviously, if you have somebody with very crowded teeth, we definitely need to remove tooth structure in those cases. I have done porcelain veneers on patients from the ages of 14 years old to 80 years old. The 14-year-old, we removed no tooth structure on. She had discoloration in the enamel due to a high fever at a very young age, and this I actually did after she had braces on. So on that, it was a very non-invasive procedure, but again, it changed the color, the shape, and the patient was delighted with the way they turned out. And when you see a child that's afraid to smile, that won't smile, and then all of a sudden she feels good about herself and she smiles, you've done something that contributes to her emotions and her self-image.